I was in the emergency room with Dr. Steinberg, and I noticed a disproportion of men who was coming inside the emergency room with elevated PSA and prostate cancer, and they was literally dying. Some was never leaving the emergency room. And I asked Dr. Steinberg, why is this? I said, I had prostate cancer, but I didn't die. He said, well, Curtis, he says two things. One, men does not like to go to doctors. And secondly, they don't have insurance. And I talked to the president of the hospital, and he said, Curtis, we really like to do this, but we don't have the funds at this time to do that. And so I told my wife, we need to put up some money to get this thing started. And she said, well, what do you think that we should do? I said, well, I think we should start it with $50,000. And my wife gave me that look, you know, like $50,000. I said, well, okay, maybe we'll give $100,000. She gave me that same look. I gave her the checkbook and I went to bed. And about 3 weeks later, the same guy, Paul Pendergast, called me up. He said, Curtis, he said, corporations have been very benevolent in giving us large gifts, but never one individual has given us this type of money. I said, what are you talking about? He said, well, no one has ever gave us $1 million. I said, what you talking about, Willis? So I said to my wife, I said, honey, I said, how much did you give them? And she said to me, don't worry about it. We got to stop these men from dying and take out the trash. And that's what I did.
I knew nothing about the Curtis Robinson Center, you know, and as the young lady explained to me what it was all about, I began to at least feel relieved that I was able to get the help and I was able to get some guidance as to what was going on with my situation, which was prostate cancer. You know, anybody who's not dealt with that form of cancer, you know, wouldn't really be able to relate to what really goes through your mind, let alone it being cancer. But again, to come into a place where you knew you could get help, where you knew you could get support, that was what the Curtis Robinson Center did for me.
The opportunity to have a center where you're able to look at a health system, like a hospital or a group of hospitals, and imagine that the work that is still to be done would require us to get out into the community, actually know people better outside of an exam room. We have a lot of men, women, children who are living in this community and communities all around New England who, when they wake up in the morning, they say, maybe I'd like to talk with somebody about the pain I've been having or about the worries I'm having, or maybe even a bridge to helping me find a job. Our center, the Curtis D. Robinson Center for Health Equity, is designed to make that imagination real.
I've taken on the role of gathering support for people who are engaged in learning more about self-management of their chronic condition, and that turns out to be diabetes, pre-diabetes, and people who are not diabetics at all but are interested in it.
I was a part of the Enhancing the Moment initiative for diabetes. I am a diabetic, and what I learned from all of that is that even though you have diabetes and you attend your visits to your doctor, there's still so many things that you can learn that you sometimes forget.
We have developed what we call the passport. And you know, when you're traveling, well, this passport we're talking about is when we go back and forth to our doctors and when we're going to the pharmacy, everything that we're doing that relates to our health.
Well, when I first went into the passport, I was saying to myself, oh, this is going to be on the computer when you go to the doctor's office. I don't really see why you need to have an individual passport. But as the program emerged, I could see the advantage that it would be for people with chronic illnesses like diabetes.
It helps you to write down questions, your medications, things you want to know that the doctor sometimes doesn't have time to sit and talk to you about. And so we learned that in order for you to improve your health, you have to take control of it.
you come into this space where we have dedicated for that purpose, and we spend 2 hours talking about foods, reading labels, understanding nutrition facts, knowing what a portion size is rather than knowing what they have as a serving size.
If I'm really paying attention to my health, and if I'm just doing, as I say, some of the best practices that it can only help, the exercise and just limiting the salt intake, eating the right protein, following the plate, as they call it. So I think that's really important, and it has helped me tremendously.
For cooking matters, for enhancing the moment, or for Live Well, the 3 programs that I'm deeply engaged in. I find that you tell one, and one tells another, and that one tells another, and if 3 go out, then 6 come back.
Language is a barrier. How can a physician help you if they don't really understand exactly what you're talking about? So it's properly housed at the Center for Health Equity because it's a disparity issue. We have a very high Spanish-speaking population. We have a very high Burmese-speaking population that come to St. Francis. So we have to meet the needs of our patients, not only for safety reasons, but in a way to sort of break down these cultural barriers and to make them feel very comfortable.
At the Mandel Center, we care for thousands of patients, and we've used a variety of language services, including the MARDI. We have staff who are going through training to be certified interpreters. It allows us ease to communicate with our patients, and it puts our patients at greater ease to be able to talk to a variety of healthcare providers.
So the Qualified Medical Interpreter training is essentially phase 2 of the Language Services Program. It's a 40-hour medical training offered once a week on site every Tuesday for our staff that identify as multilingual or bilingual. It was very essential to utilize the internal resources that we have here and really enhance our staff being really involved in this program as a whole.
We have a diverse community. We have patients that come from Vietnam, patients that come from South America, Africa, so many places, not familiar with the English language.
I feel like more of a professional interpreter versus just someone just standing in the room speaking. I'm more compassionate now. You understand more of the importance of interpreting and the need of interpreting.
The patient has a greater understanding of what's happening with their care, and it also improves their compliance. So we've had several patients where we've noticed an increase in compliance when the language services are available for them.
And a health system means we need to be anchored into this community, to know people better, to learn better how to provide care, and to learn, frankly, what the community needs that we may never know without sitting in settings like this center.
And I just thank God for my wife Sheila and my family in terms of allow us to be in a position to continue to do this. And we got such wonderful people here. We got a wonderful staff of people who just, you know, you couldn't pay them for what they do. They do it because they love it. They do it because it's the right thing. They do it because they know this is what God wants us to do.